Hey everyone! Today I'm breaking down everything you need to know about strokes, their causes, prevention, and treatment. Let's get started. A stroke happens when blood flow to part of the brain is interrupted, causing brain cells to die. There are two main types, ischemic and hemorrhagic. Ischemic strokes are the most common. They occur when arteries are blocked. This can be due to atherosclerosis, where fatty deposits build up in arteries, or blood clots that travel to the brain from the heart or other parts of the body. Hemorrhagic strokes, on the other hand, involve bleeding in the brain. High blood pressure is a major risk factor here, as it can damage blood vessels and cause them to rupture. Other causes include aneurysms, arteriovenous malformations, or AVMs, and head trauma. The symptoms of a stroke can vary depending on the type of stroke and the area of the brain affected. However, common signs often appear suddenly and can affect various bodily functions. Here are the primary symptoms of a stroke to watch for. FAST method for recognizing stroke symptoms. The FAST method is a quick and easy way to recognize stroke symptoms. F. Face drooping. One side of the face may droop or become numb. Ask the person to smile. If the smile is uneven or lopsided, it could be a sign of a stroke. A. Arm weakness. One arm may become weak or numb. Ask the person to raise both arms. If one arm drifts downward or cannot be raised fully, it may indicate a stroke. S. Speech. Difficulty. Speech may be slurred, or the person may have trouble speaking or understanding speech. Ask the person to repeat a simple sentence. If they have difficulty, it could be a stroke symptom. T. Time to call 911. If any of the above signs are present, call emergency services immediately. Time is critical when it comes to treating a stroke. Additional symptoms of stroke. In addition to the FAST symptoms, other signs can include sudden numbness or weakness on one side of the body, including the face, arm, or leg. This can affect a specific part of the body or the entire side. Sudden confusion or trouble. Understanding. Difficulty understanding speech or sudden confusion, especially when talking or following conversations. Sudden trouble seeing. Vision problems in one or both eyes, including blurred or double vision or loss of vision. Sudden difficulty walking. A person may experience dizziness, loss of balance, or lack of coordination, making it hard to walk. Severe headache. A sudden severe headache with no known cause, which may be accompanied by nausea or vomiting, could be a sign of a hemorrhagic stroke. Sudden trouble with coordination. Lack of coordination, trouble with basic movements, or an inability to maintain balance. Nausea or vomiting. Particularly in the case of a hemorrhagic stroke, nausea or vomiting may occur due to increased pressure on the brain. Other possible symptoms: difficulty swallowing, dysphagia, sudden memory loss or trouble concentrating, severe dizziness or vertigo. What to do? If you or someone else experiences any of these symptoms, act immediately. Call 911 or your local emergency services number right away. Don't wait. Even if the symptoms seem to improve, it's still crucial to seek medical attention. Note the time when the symptoms started, as it helps healthcare providers decide the best course of treatment. Understanding the underlying causes of stroke is crucial for effective prevention and treatment. By recognizing the risk factors and symptoms, individuals can take proactive steps to protect their brain health and reduce the likelihood of experiencing a stroke. Now, let's talk about preventing strokes. The key is to manage risk factors. First, control high blood pressure. Hypertension is the leading risk factor for stroke, so regular monitoring and lifestyle changes are crucial. Next, maintain healthy cholesterol levels. High cholesterol can lead to plaque formation in arteries. Eating a balanced diet, exercising, and if needed, taking medications like statins can help. Regular exercise is also important. It improves cardiovascular health and lowers blood pressure. Speaking of diet, aim for one that's low in sodium and rich in fruits, veggies, and whole grains. Limiting alcohol and avoiding excessive salt are also key. If you smoke, it's time to quit. Smoking damages blood vessels and increases blood pressure. Managing diabetes is crucial too, as high blood sugar levels raise stroke risk. For those with heart conditions like atrial fibrillation, effective management often includes anticoagulant medications to prevent clots. And don't forget regular checkups to catch risk factors early. Alright, let's move on to treatment. The approach depends on the type of stroke, severity, and timing. For ischemic strokes, clot-busting drugs like RTPA can dissolve clots if given within 3 to 4.5 hours. Endovascular procedures, where doctors remove the clot using a catheter, are another option. Medications like aspirin and blood thinners help prevent future clots. For hemorrhagic strokes, surgical interventions may be needed to stop bleeding and repair vessels. Medications can control blood pressure, prevent seizures, and reduce brain swelling. Recovery often involves rehabilitation. Physical therapy helps regain movement and strength. Occupational therapy improves daily functions. Speech therapy aids with language and swallowing difficulties. And psychological support is essential for mental health. Remember, the quicker the treatment, the better the outcomes. Recognize stroke signs, sudden numbness, confusion, difficulty speaking, or severe headache, and seek emergency help immediately. Thanks for watching. If you found this video helpful, please like, subscribe, and share. Stay healthy and informed.